interesting combination that we're going to talk about today, and that is what does this have to do with HSP or PLS? Okay. But Ruth has come to us today because she is and has been named, has received the award of Therapist of the Year. Let me start off with that first. So thank you, Ruth. And this is a treatment tool that we may need to consider as we are fighting the journey of HSP and PLS. On top of all of this, Ruth is a speech language pathologist and has been involved in using hippotherapy as a treatment tool in her practice since 1978. She's got some knowledge. She's got some abilities to help and work with people that have HSP, and not only that, but those that have PLS and have difficulties with their voice and the speech. She may be able to offer some additional advice about that. And I know that affects some of our folks with SPG7, maybe some others that are also, on screen, maybe the SPG 50s, those kind of folks as well. So Ruth, without any further delay, thank you so much for joining us today, and we'll take questions at the end, but feel free to take over, dear. Thank you.
Thank you. Well, before I go to the PowerPoint, yes, I'm really happy to be here. And just a little additional background, besides being a speech pathologist and professional horsewoman, I am a faculty member for the American Hippotherapy Association. And so really the presentation that I'm going to give you pulls together information from the American Hippotherapy Association, because that'll end up being a good resource for you all, should you be interested as we go forward. And I will note that a lot of the slides, just because my practice is pediatric right now, but I did do adult rehab incorporating hippotherapy or equine movement for 25 years. So although most of the pictures will be of younger children, I want you to think about the things that I say are also extremely relevant to adult populations and any of a broad range of neuromuscular issues, including the struggles that you all are dealing with. So with that, I'm going to bring up my PowerPoint, and hopefully we pre-flighted this and it will all come right together. Really, this is just going to be an introduction to hippotherapy, which really is going to translate to equine movement as a treatment tool. And just the standard, that these are copyrighted materials, but this presentation I think will be available for you all as a recording later, and so that will be awesome. It's just protected material, and just because there are videos and pictures, remember that we're always careful about HIPAA compliance anytime we're dealing with anything in healthcare. So, all right. With that, in the broader context of horses and humans in the United States, it kind of breaks into three big categories. So therapy, which is what we're going to talk about today. There's also some educational or facilitated learning applications. And then most people are familiar with therapeutic or adaptive horseback riding, which technically is an adaptive sport, and adapting the activity of riding for accommodating whatever kind of challenges or special needs might be there. But we're going to focus our discussion today on the application of therapy. And this definition or description is kind of a mouthful, but basically the term hippotherapy refers to how therapy professionals in occupational and physical and speech and language therapy manipulate equine movement as a therapy tool to really engage all the physical systems to promote functional outcomes. And it's not its own therapy. There's not physical therapy, speech therapy, occupational therapy, and hippotherapy as a separate service. It's really a tool within the bigger context of our standard treatment. So it means that it's not really a standalone, that we recommend that hippotherapy be integrated with the other therapy tools and strategies and activities that might be appropriate for any given client that we're treating. It is accepted as a standard practice tool in the United States, and our national therapy associations have supported its use clear back to the mid-1980s. So it's actually should be pretty well grounded, although people are either familiar with it or they're not. It's just kind of one of those things. We as therapists have lots of tools in our toolbox. And so that's something important to remember. But then the question becomes, why would we use a horse? And to begin with, that movement, horses go up and down and side to side and forward and backward, and they move through space. So they have multi-dimensional movement that's symmetrical, that's rhythmic, that's kind of a low amplitude movement that can be sustained because we can keep them moving. It can be very organizing in kind of putting together your physical or biomechanical systems and your sensory systems. I like to say that horses are so highly organized neurologically on their own, and they're kind of lending their neurology to us. And it has a very systems-wide impact on our bodies, on our human neurophysiology. And just kind of breaking it down a little bit, when you're sitting forward astride a walking horse, the human's pelvis is sort of at a 90-degree angle to the horse's pelvis. And that's important because a major piece of what happens starts at the relationship between the horse and human and around the core of the human body. Okay. So just to kind of get that in perspective, here's just a walking horse, and just look at how much movement is translated through his spine and his hips in particular, as he's walking around. And the handler just graded it down to a very slow or contained walk, but you can still see all of that movement that you can you're going to see in a moment with an adult on a walking horse. How that movement is translated, okay? And so there we go. So here we have an able-bodied, a neurotypical adult on that same horse. And as she's walking around at kind of a medium walk, look at how much movement is being translated up through her body. And there's a fair amount of documentation that supports that when an adult is on a walking horse, it provides very similar input to normal human gait, that the pelvic movements and the weight shift side to side and all of that is very close approximation of normal adult walking gait. Children don't walk like adults, but we're still activating a lot of the same systems. So the idea is that we can use that movement to promote active responses, and that we can vary that movement and get different impact or effects. And we're always looking to how that's going to improve that individual when they're off the horse, their functional skills. So here with little boy stacking blocks, or even the little girl in the wheelchair who's learning how to use an eye gaze computer, and the movement of the horse has helped her get enough upper body strength and control and ocular motor or visual control to use an eye gaze computer. I mean, what a wonderful gift for her to be able to communicate. So we're basically using that movement to facilitate all these different things, from arousal and postural control to motor planning to sensory organization, all with an eye towards how it's going to impact function. And here's the thing that's so powerful. The average horse takes about 100 steps per minute. Now think about that. That means even 5 minutes would be 500 repetitions. So if you're in a typical therapy session, you might be moving, like this adult will probably be moving 20 to 25 minutes. Look at the opportunities for promoting activation of all the different physiological systems in a very graded, controlled fashion. There are a lot of other dynamic movement tools that we therapists use, but none of them can operate at that level. And it's just, I mean, it's just phenomenal. And it's funny because it always just looks like we're leading people around on horses, but there's a tremendous amount happening all the time. We can treat a very broad range in terms of age, typically around 2 years of age on up through adulthood. I think my most elderly patient was 86. And so we can go, the broad range of ages and many, many different kinds of um, diagnostic categories. This is just sort of a laundry list. And within that, any of the neuromuscular impairments or diagnoses that are potentially degenerative. Equine movement has been gathers momentum and being like just the right amount of movement to really help preserve function and promote function and not break down the system. There will be some people that should not be on the back of a horse. There are a few contraindications, and more often it's more precautions that we need to take with certain kinds of things that we might be dealing with. So here's just, I mean, I laugh because this really will just kind of look like we're leading a little kid around on a horse. But this little girl who doesn't really know she's getting therapy right now, she's just having a great time talking to her occupational therapist, getting movement. And look at how much movement is being translated up to her. And then another therapist in the background is going to direct the handler to dampen or shorten the step down. So the little girl had to make a postural adjustment, and it's all very, kind of slow and graded down. Then they're going to lengthen it again. And I show you this just so you can get a little idea that we're just really trying to figure out ways to use the movement towards whatever our client's needs are. So, and there we go. So I'm going to go on. All right. So thought I would just dive in a little bit just to kind of point out some highlights. So the postural impact of equine movement, we have to have postural control for pretty much anything that we do. And that equine movement, which is symmetrical and integrated and predictable and sustainable, can facilitate very functional postural responses and target that core control and coordination and gentle mobilization of the spine and the pelvic region. And then if you have somebody's legs in stirrups and have platforms under their feet, you can really even get more joint mobilization through the legs. So we can use equine movement to really support ambulation or walking. And just those areas, those big systems there in those circles around here on this graphic, your cardiovascular, your balance and posture, sensory integration, arousal, motor planning, strength, endurance, all those things can be promoted through graded movement of the horse. And just as quick examples, so then we might be using the movement to facilitate core activation and reciprocal leg movements, and then get off and work on gait training. There's a little bit of Katie right there. Or another example, you have a little boy in 4-point on a moving horse, working on strength and motor planning, and then getting off and translating that to strength and motor planning to step up and down off of a step. There's a tremendous amount of sensory input that you're getting when you're on a walking horse. Your balance and equilibrium through your inner ear, the visual piece, the joint information through your proprioceptive senses, and it's sort of embedded on a functional task of staying on a horse, and it can really promote integration of your sensory information coming in with your postural information, while at the same time helping to mediate the level of arousal, bringing arousal up or bringing it down, helping to sort of regulate stress responses. I have often had situations where people experienced a lot of different emotions on the horse just from the activation of their emotion centers, their limbic system, while they were on a horse. And so it's just really has a systems-wide impact. It's not just biomechanical. So we can take that and we can hone in on another area that we all need skill in, our fine motor skills. And so using all that sensory input, the components that we need to be able to complete tasks like dressing ourselves or cooking or handwriting or playing ball or whatever we're doing, attention, concentration, engagement, and then because it's impacting the core system, and then that helps stabilize the body so you can use your arms and legs and certainly your arms and fingers and hands in motor planning, very acute fine motor tasks. And so we can, again, a little example of moving around on the horse to promote sensory motor integration and arousal and self-organization, and then getting off and learning how to cut and being able to sit down and do that functional task, which for this little boy is really important. And just generally being able to create a very therapeutic sweet spot for people. In other words, a good arousal level, self-organization, feel good, getting neurotransmitters to release. So you just are in a better place to cope. There's a lot to be said for that. One of the areas people don't seem as, it doesn't seem as logical to people about how the movement of the horse can impact speech and language. But honestly, your speech and language is only as good as the systems that support it. So having postural control, having strength, having coordination and timing, having enough respiratory control to control the voice stream, all of those things are critical. And so we can, in the same way the movement of the horse facilitates all those systems for walking or fine motor skills, it supports what comes out of the mouth. And it does so in a very pragmatically loaded or very functional setting. There's a lot to talk about. It's a very motivating setting. It makes sense to talk. We can even talk to the horse. We can do all kinds of things with it. And, here's just kind of there's any one of these areas has many, many layers to it. So I'm just really introducing these ideas to you. But for example, if we improve postural control through having more stability and alignment, then we have more stable trunk, and that frees up the body to maybe even have more breath support and allows the oral motor speech mechanism more freedom to produce clearer speech sounds. And then when somebody can produce clearer speech sounds and has more respiratory support, then it may turn into longer sentences and more functional sentences. And whereas this can be very true in developing speech and language, this is something I saw a lot with adults that I treated who had suffered strokes or traumatic brain injuries, or did in fact have different neuromuscular diagnoses, where we could facilitate all the systems that support communication and help make speech and language more functional and maintain that functionality over a longer period of time. So here's just kind of a little example of a little girl who, before she gets on the horse, her sitting posture is very closed. Her chest is closed. She's stabilizing on her hands and feet and has her knees in together because she really can't sit up by herself very well. And it makes it really hard to talk that way. And after she has gotten some equine movement, she's able to sit more upright with her feet flat on the ground. And that just opens up her chest and her respiratory system, and her body is opened up to support her speech and language more functionally. And then just other little examples of things we can do. So here we're actually labeling pictures while we're moving on a horse. And then maybe that's too much for that child. So you get off and you do a similar task off the horse, but you've used the movement of the horse to facilitate all the systems, or overlaying a communication device on the movement of the horse. So this little boy is being able to talk to us while he's going around, directing what he's going to do on the horse, or then maybe moving from the horse to a tabletop, more conventional language task. Lots of different applications. And honestly, when you come into our facility, we have an indoor arena that opens onto 4 other therapy rooms, and we go back and forth between the horses and the other tools and strategies and activities that we have, just all the time. Have just blended it all together. So using this tool is unique in that it does require a team. So whereas as a therapist, I can normally sit across from my client and just be one-on-one, when I'm using hippotherapy, I actually have to have a little more support. So there's the therapist, there's the equine or the horse and the horse professional that's going to help manage the horse in the treatment. There's the referring physician, whom I'm going to be talking to a lot, helping to establish medical necessity for skilled therapy and making sure that, you know, we're moving the direction we need to with that client. And then you may or may not have safety aids or what we call sidewalkers. Different clinical practices that use hippotherapy have different protocols around the country. And so sometimes you'll even, at our place, you'll actually see a sidewalker or a safety aid. Very often the therapist is providing both of those roles. It's one of those, and really the horse professionals end up being therapy techs and become very much part of the treatment team. And it's nice when it's very seamless. It just all kind of works. So we're going to take a look at Katie. This is actually a little clip of a co-treat between physical and speech therapy. The physical therapist is on the left and the speech therapist is on the right. And basically, we're going to be using the movement to work on postural control and upper body strength and coordination, which she needs for her walking and other, you know, motor tasks that she needs to do, but she also needs for speech sounds. And so in this particular little clip, the physical therapist is really kind of providing support and monitoring, but the speech therapist is doing the activity, and you'll get a sense of how this goes.
Horse, go. My horse. Go. Good girl.
So they will spend a period of time walking, and we won't show all of that, but it just gives you an idea of first using the movement to kind of activate her system. You can really see how she's getting that input up through her body. She's kind of shifting weight from side to side as though she were walking. She's very actively engaged. And then they've turned her around and sat her backwards. And she's supposed to be holding her arms up to throw the ball, which is very hard.
Hands down. Good girl. Ready? Here. Whose turn? No. Whose turn? Yeah. Come. All right. My turn. Get up. No. Up. Up, up, up. Throw. Good job. All right, again. Ooh. E. E. Good. Throw. Good girl. Catch. Throw. Good girl. Catch. Throw. Good girl. Catch. Throw. Good girl. Catch. Look at me. Throw. Nice. All right. You ready? You're gonna do your sounds. You have to do it. Loud. Okay? Here. Come over here. All right. Ooh. Okay. Ooh. Ooh. Good. E. Loud. E. Good. Ooh. E. Ooh. More. Ooh. Ooh. E. Ah. Good. Mama. Mama. Good. Ooh, E. Ooh. Ooh. E. Good. Like this with ooh. E. Ooh. E. Ooh. Good. Again. High five.
Okay, there you go. So, even though hippotherapy is not its own therapy service, it is very much a discipline for the horse, and we select horses based on their suitability to be a therapy horse, the way they're put together, what we refer to as conformation, their temperament, their tolerance for all the funny things we do, like throw balls off of their back ends, like you just saw. And we can handle them different ways. We can lead them, or in this picture, we're long lining, and there's different reasons for how we manage the horse within the treatment session. And then, as with any other, you have horses in the bigger equestrian world that perform in all kinds of venues, from jumping, racing, barrel racing, dressage. All those things require performance. And within therapy, we also require performance. And that optimal performance is based on the horse's training and maintenance and the quality of horse handling that is provided. And that is very, very important because, even though I consider myself a professional horsewoman, when I'm in treatment, I'm being the therapist, and I need to depend on my horse staff to provide the very best quality for my client as possible. And so that horse expert is responsible for managing the horse within the session safely, and becomes, as I said, like a therapy tech, working with and part of the team with the treating therapist, so that we can figure out what the patient or client needs and provide that. And then also monitoring the performance and well-being of the therapy horse, because they're dealing with a lot of very different things than they might in a dressage arena, for example. So it's important that you understand that it should be a very thought out treatment protocol for the entire team, and our clients are going to benefit from that. And our clients develop wonderful relationships with our horses. Well, most of them do. I have some clients I don't think even really like horses, but the movement of the horse really helps them, so they buy in. And then I have others that are just horse lovers from the get-go. And so then we as treating therapists are just manipulating the movement according to what our clients' needs are. Depends, we might try different horses. We might pick a horse based on their particular movement, or have them trained so that we can lengthen or alter the stride some. Most of it is done at a walk. Sometimes we'll use what we call a jog trot, just a very soft little trot, which provides a lot of input to the client. Certainly the direction of the movement, or adding in figure eights and serpentines and all kinds of different things. Here they're going over ground poles, which just lifts you up as you're going over, feels very, very different. The kind of handling, whether we're leading or long lining, the equipment that we place the client on, whether they're on a saddle, whether that saddle's an English saddle or a Western saddle or a dressage saddle, or if they're on a pad or some different kinds of surcingles. We're always thinking about what our clients are going to benefit the most from. And then positioning. I mean, certainly we start out facing forward in a typical riding position, but here you have a little boy in 4-point, or sorry, in tall kneeling, and you saw Katie sitting backwards, and we use a lot of different positions. I've actually had a number of clients who did not have upright sitting balance. They just couldn't sit up. And so we would position them where they're literally laying on the horse on a sort of a wedge pillow, with support on both sides by, people walking on both sides, and working on developing some head and neck and upper body control towards the goal of being able to sit up and do more functional skills. The little picture you saw of the girl using the eye gaze computer, she actually sits upright now, but she has to have maximum assistance to sit up on a walking horse. But what hippotherapy has done for her, besides helping her develop the skills she needs to communicate through an eye gaze computer, it also helps her from a general health standpoint, where she's a much lower risk for upper respiratory infections, because she gets this dynamic movement through her body and gets oxygenation through her whole body. So there's a huge range of things that we can do using equine movement, and integrating purposeful activities. So here, putting the ring on the noodle as we're going by, that actually is a pretty difficult task, where you saw Katie dealing with the ball. All of that is you're engaging a lot of systems simultaneously to do all of that. So who can actually provide this tool? There's, in the United States, there's all kinds of therapies, and it's important as consumers that families be aware of what the role of hippotherapy is in standard healthcare. And basically in our country, licensed therapists, and it really, I think, predominantly is the physical therapist, the occupational therapist, and the speech and language therapy professionals that it's accepted in healthcare to use hippotherapy. And we have to have good knowledge of what best practices look like when we're including this treatment tool, and what competencies we have to have, as well as that team, the horse, the handlers, the setting, the whole picture. And we have to understand the nature, the elements of equine movement, how powerful it is, and how to manage it, and how it affects the human body, the human physiology, because that's going to guide us in how we're going to meet the needs of the clients that we're treating. And within that, be able to make good judgments, understanding the risk-benefit ratios of, whether or not it's appropriate and how much is appropriate. I mean, anything that can, at 100 steps per minute, you don't really want to be, most of our clientele could not be on a horse for much more than 25 or 30 minutes. That 30 minutes would be 3,000 neuromotor repetitions. That's a lot of information. So it needs to be good quality information too. So we also, in this country, are very, very geared towards leading with our licensure. So I'm a speech pathologist, and I'm practicing speech and language therapy when I treat, even if I include hippotherapy or equine movement as a treatment tool. And my process looks like it would with any other tool I would use. I do a standard speech and language evaluation. I develop an intervention plan. I carry out that intervention. This is a tool that I probably will gravitate to because I get results faster most of the time. I'm looking at outcomes, and I'm looking to when I have done everything I can do for that client, and with an eye towards discharge. And often there have been times when we have discharged clients where they might continue with horseback riding as through an adaptive riding program, as a recreation and leisure activity, and still benefit from the movement of the horse, but not in a treatment context at that point. And then it's very important that therapists who utilize this tool have some specialized training in how to safely and effectively incorporate it into their clinical practice. And I say that because it's not legislated. It's a standard practice tool, but it would just make sense that if you're going to use any specialty tool, you understand how to do it and make sure that you're being safe and appropriate. It is important to know there's no such thing as a hippotherapist in the United States, and there's not hippotherapy programs, even though you will see that out there. You will also see equine assisted therapy quite a bit. Horses don't do therapy, therapists do therapy, and horses are incorporated into a standard therapy. That's how it should be. But, we like to slap labels on stuff, and we tend to be kind of casual, particularly in the United States. So you see a lot of terms out there that we're trying to kind of reframe, make sure people understand the role that hippotherapy plays in American healthcare. So as a result, because it's just a standard therapy tool, it's reimbursed by most insurances because it's just a tool incorporated into standard PTOT and speech. And, usually standard fee schedules. I mean, my practice is 99.9% funded through insurance and state Medicaid funds. And, I think I have one person that's paying out of pocket. So that's just something to know. And just to kind of give you a little bit of a direction, the American Hippotherapy Association is sort of the preeminent therapy or a group that we provide education for treating therapists. We have best practices and resources for therapists, but we also have a whole section of our website that just tries to provide resources for families, kind of letting them know how to access this treatment tool where they're at, and really trying to make it more available to everybody. There's a lot of us that are involved in mentoring graduate students. We teach courses all over the world at this point. And as well as part of our advocacy is to maintain a current bibliography of peer-reviewed journal information and research about the benefits of equine movement and how it impacts the human. And they're working on updating it right now, but as of last year, there were 16 systematic reviews, about 123 journal articles. There's peer-reviewed case studies and book chapters. There's a growing body of evidence that supports that this is not some new age, very experimental thing. It's actually been around for quite a while. And so we're always trying to build upon that. And then within that, as an educational entity, we actually offer a number of courses. We have our foundation courses in treatment applications incorporating hippotherapy for the OT, PT, and speech professions. And we have a number of advanced courses. We have a conference every other year and a variety of webinars and case study groups and whatnot. And we work side by side with the American Hippotherapy Certification Board, where we can provide credentialing that just tells the public that we've done our due diligence in learning how to use this tool. So the HCB board has 2 levels of certification that a therapist can attain. The first is an HCB certified therapist. They've taken the foundational courses, they've passed an exam. It's kind of an entry-level credential, but it would tell you as a family that, that therapist had done their due diligence in learning how to use this tool. And then there is a clinical specialty of hippotherapy clinical specialist, and it's a much more rigorous exam where you've demonstrated advanced skills in that area. And again, it would be similar to there's clinical specialties in our therapy professions. There's hand specialists, there's augmentative communication specialists, there's swallowing specialists, there's pediatric specialties. There's lots of different specialties in healthcare, and we've patterned that after this. But these and for you as the general public looking at this tool, it's important. These certifications help put everybody on notice as to whether or not a therapist has really done their due diligence to learn how to use equine movement as a treatment tool. So it gives you a little better assurances in that regard. So, and just kind of as a summary, equine movement or hippotherapy, they're sort of and is a standard tool in occupational and physical and speech therapy. It's a very valuable tool that can be used in intervention by that trained, licensed therapy professional. Our focus is on how to use that tool to improve people's lives for better functional outcomes. I always laugh and say we want people to walk and talk and sing and dance better after they have been through therapy. And so it's important whether you're, looking at the needs of a child or if you're looking at the needs of an adult, that the therapy focus be on improving quality of life and functional outcomes. And that anybody who's incorporating hippotherapy within their clinical practice really have not only their own licensure and lead with their scope of practice, but also be involved in learning how to use this specialty tool appropriately. And there is the contact information for the American Hippotherapy Association. And we have just revamped our website a little bit. And so they're in the process of uploading the resource page. And there are resources for families. There will be, if it's not functional yet, there's a whole Find a Therapist area where you can, look to your state and find therapists that are either AHCB certified or are clinical specialists or have started the process of getting educated and so forth. So with that, I'm going to stop sharing and be more than happy to entertain questions.
Golly, Ruth, thank you so very much for all that information. That is absolutely amazing. That really touched my heart. And the young lady that you were showing, the child that was playing with the ball, I have to just appreciate what she's doing. And you guys, she's on screen with us today.
Yes,
They
she
don't
is.
they don't have their camera showing, but just so that you know, maybe at one point or time before the closing, maybe they were able to come on and join us, and you guys can see this young lady. But that is really
There she is.
Here comes Caroline. Hi, Caroline. We were just loving the video of Katie. That was absolutely just touched my heart. Thank you for sharing that.
So
Ruth,
I
thanks for
have to
using me.
share. Yes, and I have to share. So I actually, one of the benefits of having done this since 1978 is that I have a very deep well of experience and have a wonderful team. And Caroline can attest to that. I have a very top-notch horse team and horses and whatnot. And we went out on a limb a little bit with Katie when we actually started Katie when she was about between 13 and 15 months old. She was a peanut. She was little. She was not on the horse for very long at a time, and we had to be very creative with our positioning, but she started very, very young. And she did, yeah, she did phenomenal. She really did phenomenal. And I think it's interesting because Caroline, you can speak to the fact that it was many, many years before you actually got a diagnosis. So this is interesting to look back at her journey in light of her having the HSP diagnosis. It would be HSP, right? Diagnosis now.
That's right.
Sorry,
Yeah.
it's not one that rolls off my tongue yet.
Well, and Caroline, if anytime you want to speak and you want to,
Yeah.
bring any personal information to the table, you please feel free to just raise your hand or start talking or whatever. But you've been on this journey since Katie was born. And you might even share with folks that are on with us what SPG number she has if you want to do that. It's only totally up to you.
It's fine. I want to make sure I don't take up too much time, but I wanted to share Katie's now 20 years old. And I think you're right. It was around 13 months that she started riding or going to hippotherapy at Skyline. And we moved in the first year, it was only once a week. We went to twice a week because I could see the value to my daughter. I don't think Katie moved in unison. She has SPG 50, hereditary SPG 50, and she was not diagnosed till age 16. So we didn't understand all the medical complications that developed in the most recent years. She made lots and lots of progress, plateaued, and then all of a sudden started going down, and there were all these medical complications that we didn't understand. And from my perspective, having a diagnosis helps us be more realistic. But I don't believe my daughter would ever have walked. She couldn't separate her legs to be able to use both legs. It was in unison.
Yeah.
She was.
And I had no understanding that they called it cerebral palsy because they didn't know what else to call it. But and we continue to have that diagnosis because it's a bucket that provides opportunity for treatment. But from my perspective, I hear a lot of parents with younger kids who are really showing some stress because I don't want to read into their feelings, but a lot of stress because they don't want their child to become what the diagnosis when they read it says.
Right.
And I look back and I said, well, why is Katie different? We're in the NIH study out of Boston Children's Hospital where they're trying the longitudinal study for SPG 50, and there's 3 other SPGs that they're doing. And there are only 2 individuals that are reported worldwide. I mean, it's a rare condition. There's about 100 people with that diagnosis that are still walking, and Katie uses a walker today. She does have challenges walking, and we use Botox to help facilitate some of that, so her muscles are not always tight. But what I racked my brain, I said, what is it that's different about Katie? And at the time, I only knew of her. There's one other individual. I haven't spoken to the family. Why is Katie still walking? Because after age 15, it's not known to be happening. And I really attribute to the fact that we did hippotherapy. I mean, we did a lot of things. But I remember that, I remember thinking Katie never would have walked without hippotherapy in her life. I mean, the therapies on the horse. And so that's why I reached out to Ruth. I said, Ruth, I really think that this information can alleviate some of the desperation that I hear of some of the parents of younger children. Now, I don't know what it's like to have it, SPG or the other conditions personally, so I can't speak to how other people feel as adults, but I know I see a lot of postings saying people are really, they don't like how their body's changing. So anyway, that's all. Unless you have a
So
question, that's really what I will share. I
Thank,
really think it was
thank
life
you,
altering for
Caroline.
my daughter. Yeah.
Thank you,
I,
Caroline, again, you and Katie. That's really appreciated, the journey that you guys are on and helping to bring Ruth and this technology to our forefront. And I think this is highly important because, as you guys know, we're working every day to figure out what are the mechanisms, what's going on, what's happening. Are there medications and any kind of therapeutics, that can actually be ingested that can stop what's happening in most of our families, our bodies. But in addition to that, there's got to be a therapy of choice, and not everything works with everybody. And that's really what is got to be so unique about you. And but yet it's another tool in the toolbox, and we need to be finding ways that we can make connections about these kinds of therapies and therapeutics, because I don't know that I've ever heard this at all in any of the conversations that we've had previously. So I appreciate the knowledge of what's going on, and whether or not these kinds of organizations, Ruth, are available across the United States. What if there's not one in a community? What are some options? Is riding horseback helpful?
it could be, it could be. So it's important. I mean, I don't have a lot of experience with the particular diagnoses that you guys are struggling with, but I do have quite a bit of background with patients who've had Parkinson's
Yeah.
or and some other Friedrich's ataxia, some other neuromuscular diagnoses that can be degenerative, and muscular just MS, multiple sclerosis. And we've shown for years and years that we could use the movement of the horse in a really graded fashion to help keep all the systems working better longer. And that, I mean, it's not a cure, obviously, but it's something that can help maintain integrity of function. And that's not just walking. It can help maintain what's happening systems wide. So it can promote speech, it can promote just endurance, it can promote fine motor skills, gait, all of that. And I think it would be a very interesting, I think it is something that you guys probably need to have more conversations about. There's there's probably, I don't know, 750 to 800 facilities in the United States that I'm gonna work backwards, that actually provide adaptive horseback riding under an organization called PATH. That's the Professional Association of Therapeutic Horsemanship International. Now, what they're really about is adaptive or therapeutic horseback riding. But within those centers, there's very often therapists who are also providing a treatment component. So there'll be a physical therapist that has got a little practice in there or whatever. Like my facility, I don't do any adaptive riding. We're just 100% therapy. But if you have no treating therapists in your area, really those PATH centers, those therapeutic riding instructors have some skill in dealing with just kind of creating a situation. Like, for example, as an adult, we use a mounting ramp. You saw Katie come out of a ramp. Well, you can walk up the ramp and get on, so you're not having to pull yourself up on a horse, for example. Or we can do a wheelchair transfer. And then you can use the movement of the horse, and it might be just getting range of motion. I mean, there's a lot of things that it might be very good, as an activity, just being sure that you're doing it with all the safety parameters in mind. So if you know a friend and they have a backyard horse, I don't know, that's the place to start, depending on the horse. You know what I'm saying? But in an ideal world, you would actually have a therapist evaluate kind of where you're at and have an understanding of equine movement as a tool, and maybe start there and then bridge, because it's hard to have therapy. Therapy's funny. It's like it's you need it, and there's certain therapies that are kind of more maintenance oriented, and you need that with a diagnosis like this. But at the same time, that's always not always sustainable from a insurance reimbursement standpoint, from a funding standpoint, whatever. So you have a broad spectrum of opportunities. You have treatment that actually is focused on using equine movement as a treatment tool, and all the way to getting involved in an adaptive riding program where you're and whatever level you're at. It can just literally be just moving on the horse, or it could be learning to ride. I mean, it can be a lot of different presentations.
Let me ask you a couple of more pointed questions. I
Sure.
think this is really important, and I'd like to see how we can find that information out, and then perhaps maybe put a link on our website so that people in all across wherever that can have access to this horsemanship program. I think we at least need to get that information out. So if you could provide that, that would be great. Now, does
Okay.
the National Association, do they do some kind of tracking to actually look at clinical outcomes and any numbers that might be related to knowing how many HSP or PLS patients that they may work with? Do you know if they
I
put that data down?
I would say at this point in time, probably not. American Hippotherapy Association's biggest objective has been to literally provide education to train therapists. And so we've talked a lot about how great it would be to do some multi-center clinical
Yeah,
data collection or whatever. We're like every other not-for-profit organization. Funding is tight, and trying to figure out and how to be everything to everybody and meet
yeah,
a lot of different needs simultaneously. So we're definitely under resourced, but
yeah,
I do think that it, even on a survey level, for example, like bridging your organization and AHA and
yeah,
having some way to track those numbers. I think that kind of thing is all doable. And it's important to know that this other organization I told you about, PATH,
yeah.
PATH really is a national group that oversees adaptive riding more. And even though there's a lot of therapy embedded in those centers, like we have a good relationship with PATH. We work side by side with PATH on a lot of things. Um, and so I think there's ways. The other thing that we actually, I'm just thinking off the top of my head, there's also something called the Horses and Humans Research Foundation, HHRF. That's a very interesting website to go to, and they actually try to fund research, larger studies looking at horses. And yeah, and so that's where you can see
Bingo.
where your eyeballs are. Yes, you're going right
Yeah.
where you're supposed to. So there's quite a lot of interest worldwide on this whole topic. Horses and humans are,
Yeah.
who was it? I think it was Socrates that said the outside of a horse is good for the inside of a man. Then I think Ronald Reagan took that up as one of his mantras, but actually it came from Socrates. Anyhow,
So let me ask you this question, if you don't mind. So when you're
sure.
looking at it from a patient's perspective, and you are, trying to figure out is insurance going to pay for that? Do you see also that perhaps maybe Medicare does also to consider that? How does that
So
work?
we're in a really interesting spot with Medicare, and it's a very long story, but it'll be very much on a patient by patient basis. What I will tell you is that it has to do with how therapists present it, or if you called the Medicare office and
Yeah.
said, "Do you cover hippotherapy?" They're going to say no,
Yeah.
because there's no such service. Okay,
Right.
there is no such thing. That
Okay. Good to
term
know.
is an international term, and that's how it became part of this country's vocabulary, but it's problematic. We just can't think of a better term because it just, it's really, it just gets complicated. So, but if you're getting physical therapy and your physical therapist includes 15 minutes of mounted work on a horse, and then you're off and maybe you're on a stationary bike, I don't know, whatever, then then it should be covered because it's just a tool. And that's been the most frustrating thing um, about the whole paradigm, has been trying to not have people. It's a powerful tool. There are times when it feels miraculous. I have many videos pre and post of somebody looking very different, the way they walk or the way they talk. But that being said, so people get caught up in it, and then it kind of takes on a life of its own. And it's from a licensed therapist perspective, we've got to make sure we represent it accurately. It's one of the tools. It might be my very best tool, might be the very best thing I can do for a patient, but it's still one of the tools that I have available to me as a therapist. And so I'm very involved. Besides teaching courses, my other big role is on what we call the Ethics, Advocacy, and Reimbursement Committee of the American Hippotherapy Group. And I'm working constantly. I just had a conversation about 3 weeks ago with a gentleman in Dr. Oz's office at Medicare in Washington. And it was a conference call, but trying to get them to understand that it's
Yeah.
just a tool, just like the therapy ball or a bike or a balance beam or a mat. And he got it, but trying to change, we have to constantly kind of change the culture, and it gets confusing because the general public is running around talking about equine therapy, and
Yeah.
that's really not a thing either, unless you're rehabbing a horse, I suppose. But
Yeah,
yes,
and see,
ma'am.
that's the thing. That's the thing. That's what we're trying to talk about at the Spastic Paraplegia Foundation is we've got to learn the right terminology when we're talking to whatever party that doesn't
Right.
understand what our disease is.
Exactly.
And every
Yeah.
aspect of our bodies in some SPG number is affected by
Yeah.
everything that you've gone over on your program,
Yeah. Yeah.
PowerPoint. So that to me
Absolutely.
is amazing. And we've got to find a way that we can make these connections and
Mhm.
use what you're doing to help some of the people. It's not for everybody, just like everything
Right.
else is not for everybody. But there are a lot of people that want to get into adaptive services that can make their bodies do some things so that they can
Exactly.
reprogram themselves. And that's
Right.
what we're trying to do is to get people
Yeah.
to understand that it's not going to be a one-time fit for everybody,
No.
but we're working at the toolbox, and this is
Yeah.
one of the tools in the toolbox. Miss
Right.
Jackie, go ahead. You got a question?
Yes, Ruth. I'm on Medicare, so how would you suggest I go about this? Talk to my doctor first?
Possibly. Yeah. Talk to your doctor first. So when I take on a new client or a new patient, and was the same when I did adults as well as for my pediatric kids. We, get a prescription or a referral for speech therapy or for physical therapy or for occupational therapy. And that's really what you're supposed to be dealing with your insurance carrier. However, talking to your doctor about whether they would have any concerns, any contraindications or major precautions within, your presentation and how your disease might be manifesting right now would be very important. What you'll often find is the doctors don't know a lot about it, and so you have to do a little educating as well. But if, like for example, I can recall working with adults who there was a concern about osteoporosis. Well, was I going to cause a stress fracture by taking them out of their chair and putting them on the back of a horse? And it was really very much on a case by case basis because I could also show that we were actually helping preserve bone density by the concussive impact of the horse, helping to promote, the bone growth and whatnot. So it's just sort of that conversation you do have with your doctor. And then from there, it's also knowing what therapists in your area might be involved in using hippotherapy, or if you're not doing actual therapy, if you actually lean towards the adaptive sport side of this, so going to an adaptive horseback riding program. Of course, Medicare is not going to pay for that, but those you're also just talking about getting a sports clearance. Really, it's like, can I ride a horse safely? And that might be appropriate. It just kind of depends on where on the continuum you want the services from. Does
So
that help?
you have I'm in a wheelchair, and
Right.
there's no way I could get my leg over a horse.
Oh, yes, you could. I mean, not standing on your left leg and swinging it over the
No,
back.
that would not
What we
happen.
would do, right, that would not happen. So what we would do, if I were going to see you, we would roll your wheelchair up the ramp. We would have the horse in the ramp. So it would be basically like a chair to horse transfer. And we would have somebody on the off side of the horse, and we would probably do a 2-man lift and possibly just lift you up and set you down and just gently bring your legs down. Or we could, if you can weight bear, you would stand and you would lift your leg and come over the neck of the horse in front instead of coming around over the back of the horse. So there's a lot of different ways. There are a number of facilities around the country that actually have lifts, and they will, you go up the ramp into your wheelchair. They use a hydraulic lift and lift you up and place you on a horse,
A
which
crane.
yeah,
Thank you, Jackie.
it's
I've got
wild.
another question, and you guys, I
Sure.
know we're at the top of the hour. Miss Ruth, if you could hang on just for a couple of
I
moments,
can.
you got a lot of interest here. But there was a question here that says, if people are using pro-sounding terms, how do we find an appropriate program?
Right. So one of the things that the American Hippotherapy Association and PATH are really working towards together is terminology. And so what, and you just ask a lot of questions. I mean, what you really want are a therapist that's incorporating hippotherapy as a treatment tool. That's kind of a phrase there. There's actually, I believe on our website, there is sort of a top 10 questions for families to ask document that kind of gives a little bit of guidance about what to look for in terms of not only terminology, but just, the trappings
Yeah,
of a
right.
of a program or a clinical practice or whatever. And I am very happy to share my um, email. And if you get into a question, I can usually find the right place to direct you. And so I have multiple emails, but the American Hippotherapy one would be, actually, let me just give you my Skyline one. That's easier.
Yeah,
So
just
it's
send it to me
really,
by email and I can share it with people. That would
sure.
work
Okay,
fine.
that'd be the best way to
Yeah,
go. Yeah,
yeah.
I'll do that.
Let me ask you this question that I'm going to use as my final question. When I asked earlier about other locations that might, be able to track people that have, collectively HSP or PLS in your own practice, and of course you've got, little Katie that you've been working with, but do you actually do some kind of measurements of outcomes
Oh, yeah,
concerning your patients? And most likely
sure.
then other hippotherapy locations would probably do that too. So they
Well,
could be
yeah,
actually showing outcomes of how a therapy is improving and working for them. And if they were to be encouraged with a medication or a therapeutic or a small compound, then if they have a new chemical inclusion, you would be able to see based on what you've tracked on Katie for all this time and period, how
right.
much better, or if no
Or
improvement,
worse.
or
Mhm.
if she got worse based on your physical hippotherapy with her, right?
So, yes, because as a therapist, I'm legally and ethically bound to track outcomes. So, any therapist has a set of diagnostic tools, standardized tests, guidelines for, not everything fits into a test, but guidelines for dynamic assessment, just how long you can hold a sound, pre and post becomes,
And you track
a
that.
little,
My
right,
point
an
is,
outcome.
you
So,
track
and
that, right?
right. And we're constantly in our treatment notes. So I have to generate a treatment note every time I see a client. So I'm writing down what happened, what their progress was today. And that's part of their medical record. And so, yes. And then we often have individual patients that are, trying a new medication or have had Botox or have had some other intervention of some kind, and we've been seeing them, and then we see, oh, that really worked really well with the equine movement, and we're seeing a real jump upwards, or we don't really see a difference, or actually this client is actually worse than they were a month ago. Heaven forbid. And so, yes, so any treating therapist is legally and ethically bound to track outcomes, regardless of the tool. But because we're specializing in this tool, really, it becomes part of the whole package because
And for those of you that are on the screen, know that I probably had a reason to ask that question, right? Because it sounds like to me that this could actually be considered some type of a biomarker
hmm,
for any kind of, future treatment and treatment plan. So I'm just kind of curious about how that would work. And I think that would be, I mean, no different than a gait study of watching somebody
right,
walk, whether or not
right,
they're, taking some kind of simple walking test. and how the improvement or changes of a medication might help or not help or make a difference at all.
Right.
But this is, this is also, can be considered in that category as well, I would think.
And I would highly encourage if anybody, either for themselves or for a family member, is looking to the inclusion of this tool, get baseline video. So just, if nothing else, get baseline video of walking and talking, and then use the movement or whatever, whether it's recreational, whether you're actually doing it in therapy or whatever. And then, and I mean, these days, it's so easy to track things functionally with pre and post videos. And we do that all the time. Use, take video footage both within the session and across sessions. And,
That is a very good piece of advice. And gosh, I'm going to start using that in some of my other SPF talks that, you do need baseline videos, whether you're going into whatever kind of physical therapy, how are you walking in today versus how are you walking in a month, or after you might be taking a medication to stop spasticity, then how are you walking then? How are you moving? Just get some real simple baseline movements that you can repeat, on a periodic basis. That would be a good thing to have in your own personal library. So that way we can show in clinical trials, what is actually happening, because you guys that are living with this experience, you know how you feel today based on whatever you might have done yesterday or whatever the weather's doing today or whatever maybe you've been eating today or yesterday. Some of those things can matter to your body and how your body is reacting. So knowing how that works and how that connection of all of that is in your body can make a difference. And I think having that information when we start talking to our clinicians may be very important. Ruth, it has been a pleasure. I have
Thank
really
you for having
appreciated
me.
learning what you're doing, what's going on. I can see that there can be some ongoing conversations. And you guys, do you guys feel the same way? Did you appreciate all the information?
Yes.
I know we never have enough time. We schedule these for an hour so that folks can kind of get in, get out, do whatever they need to do the rest of their day or night. And this is Awareness Week. And Ruth, I just want everybody to, appreciate you with a handshake or a wave, or maybe we can come back and have part 2.
Thank you.
Sure,
I think
absolutely.
Yeah, I'd like to get into some other conversations about what you'd said about the, the Hippo Association, maybe even talk about the speech pathology and what's happening. We've got a population of PLS patients that, it's affecting their throat, their swallowing, all of those kind of factors. And I think it would be good just to have your knowledge and experience in that.
Thank you. I very much enjoy it. It's my favorite topic.
Good. Well, thank you so much again. And you guys, I know you're over on time, but I want to tell you real quickly that we still have more SPF talks this week. It is Awareness Week. We're trying to get folks out there to understand. You guys see it on social media. Please share, please click all of those things. Share those out so that some of that stuff might go viral. And let me remind you that tomorrow at 7 p.m. Central, we're going to be talking about the annual conference, what the agenda looks like. We're going to Washington, D.C. We've extended the registration second discount deadline for the September the 1st. So if you guys are kind of contemplating, then please get that in. Make sure that you make your hotel room reservations before the block ends and the cost of that room goes up. We are at 149% of what we expected to have coming to the conference, according to the hotel. So they are thrilled. We're thrilled. We're not obligated to pay for any beds that, are not being slept in for the conference. We've got a really great group, and we're going to talk about that tomorrow night. On the 22nd at 7 p.m., we're going to be doing another open forum. And then also September the 2nd, I think Dr. Fink has already said he's not doing his open forum for the support group. We'll pick that up at 6:30 that night. And then on the 27th, that is our World Day. And we're going to be talking about USA World Day and what does that look like. And then we're going to be telling you guys about us coming together with 17 countries, and if not more, but at least 17 countries have come to the table to say, let's do a global awareness of HSP and PLS. And we've got some of our folks working in the background that's talking about doing proclamations and getting our congressmen and senators and women, all of those people to understand that we need to have this day dedicated for us. There's an MS day, there's a Parkinson's day, all of those other diseases have their day. we need our day, and we need to have that day, and everybody else in the world wants to have that day because of the understanding of research that took place. And we're going to talk to you guys about that coming up on August the 27th, and then October 17th is where 17 countries are coming together to talk about this global world day. So I want to invite you guys to be a part of the conversations. I want you guys to be a part of what's going on and what's being said. We've got so many emails and so many voicemails and all of those things that are coming in for all kinds of questions and all kinds of information that people are seeking. The fastest way for us to tell you what we know is to come onto the Zooms so that we can share it firsthand with you. You will also be able to capture some of that information on our YouTube channel. So please make sure that you guys set your notifications so that you get noticed when we put those things up, and share that information for us so the Google Analytics helps to raise the awareness on the internet for your foundation, the Spastic Paraplegia Foundation. And we're going to be talking about more details soon. So you guys have a great afternoon. Thank you again, Miss Ruth, for being with us today. I want us to get back together again and have a part 2.
Okay.
And there's so many questions that I've got, and I think this would be a wonderful tool in the toolkit, and that's what we want
Yes,
to make sure
ma'am.
we got.
Well, thank you for having me. I very much enjoyed it.
Yeah, thank you, Carolyn, and tell Miss Katie we love her to death. Thank her for being a part of our day and bringing some smiles to our faces for the journey that she's on, and I know you're on that journey with her every step of the way.
Thank you very much.
Thank you, guys. Good to see
All right.
everyone. Y'all have a great afternoon.
You too.
Thank y'all. Bye-bye.
Bye-bye.